Good morning, everybody. So you must be aware that the September month is a month of awareness on pain management. And on this occasion, we are going to talk with different practicing pain physicians from India as well as abroad. So on the first day, we have one of very senior and renowned pain physician with us, Dr. Joysree Subramanian. She was originally from Calcutta. He graduated from Calcutta, and later on, she was settled in US. I'll be just sharing her CV with you. Here is a little about Dr. Joysree Subramanian. Currently, she is an associate professor and medical director at Oklahoma University of Health Sciences Center at Oklahoma City. And she has a long career. I'm not going to the detail of all credentials. What I want to tell that she did his post-graduation from PGI Chandigarh and graduated from my medical college, Arjikar Medical College. So she is in pain practice for more than 20 years in US. She's settled in US now. So coming back to Dr. Joysree Subramanian. So you must be aware that this is a pain awareness month, and I have to ask you some questions, which is basically the question of common people, non-doctor, who are non-doctor, about this specialty. So my first question for you is, what exactly is pain management? How it is different from the different specialty? We know that there are specialty which is called orthopedics, like neurology. So pain management specialty is new. Many of the general people has not heard of this specialty. So can you just a little bit explain in few words, few lines, that what exactly is the pain management specialty?
Good morning, Gautam. So glad to meet you. Thank you for the kind introduction, and thank you for inviting me to share my thoughts on this Pain Awareness Month. Like we say commonly, we just hope as pain physicians, Loka Samasta Sukhino Bhavantu. That is our goal. Now, to define or answer your question, what is pain management? It is a specialty like you would think of OBGYN when you are pregnant or you want to have childbirth, or if there is a fracture, you would go to an orthopedic surgeon. Similarly, the pain management specialists are uniquely trained to treat any kind of pain. Commonly, when patients hear pain or pain management, they are just thinking of medication. But medication is such a small part of pain management. A very well-trained pain physician has so many different ways to tackle pain, especially with the use of ultrasound, fluoroscope, injections, therapy, acupuncture. There are other complementary methods, dry needling, to name a few. So a pain management specialist really is a well-versed physician who can assess your pain and tailor a management technique that would suit each patient.
So that means commonly we know that the pain can be managed by painkiller drugs, painkiller medicines. But here you told that in this specialty there are a lot more things. Painkiller medicine is a very small part of managing pain, and you have already named few of them. So can I ask you another question?
Sure.
That what is the basic specialty of these pain management doctors? Are they anesthesiologists? Are they neurologists? Are they orthopedicians? From which background normally they come in the field of the pain management?
Usually the people that you see who go into specializing in pain, at least in the United States, majority of them are anesthesiologists, but there are physical medicine and rehab physicians, some neurologists. Then there are other specialties like orthopedic surgery. Some orthopedicians do branch up and do some kind of pain management. And then there are palliative care physicians who kind of do pain management like end of life. So mostly you will see majority are either anesthesiologists or physical medicine rehabilitation doctors who super specialize in pain.
Okay, right. So with the background of the anesthesiology, mostly they come, but they can also come from the other specialties, right? So now another very important question is, the pain now is also managed by a neurologist, by an orthopedician, by a physical medicine doctor. So how is this management of pain is different when it is managed by a pain management doctor? Already you have answered a little bit about what is done there. So can you further elaborate that how the management of pain by the other specialist is different from the management of the pain done by the pain management specialist?
See, where every doctor, when you go to medical school, you learn the basics of how to treat pain. Everyone knows if there is a trauma patient or somebody had a car crash or a major fracture, they come to the emergency room. Everybody knows that you have to give them IV morphine or some IV medicine. It could be an NSAID to control their pain. But when it comes to, there are two different categories of pain, acute pain and chronic pain. Again, the anesthesiologists are the pain doctor. The sooner you get them involved, whether it is acute pain or chronic pain. Acute situation, let me say in lay terms, like you broke a bone, you fell, you had a car crash, or let us say you need a labor epidural, or you are going to have surgery. In those situations, depending upon where the patient is treated, it can be an acute pain anesthesiologist who is doing a block. Later on, the surgeon can manage with IV infusion or can write some oral pills for 3 to 5 days post-operatively. Same with fractures. Same with labor pain. Usually we put in labor epidurals if the patient wants. But if the patient didn't want a labor epidural, if they had like childbirth and post-op pain, the obstetrician writes a few pills. But even in the acute pain setting, let us say you are going to do a major surgery like cancer surgery or major hysterectomy. Everywhere where you involve a pain physician who is well trained in doing regional blocks or local blocks, the care of the patient becomes so much more easier and better. Whether it is oncology patient, I always say if we start with when the diagnosis is made and you have a team of doctors, it is always better care. The orthopedic doctor, for instance, he will put a cast, he can only give them up to 5 days of pain medicine. He is not well versed in doing the blocks. Some of them will say, hey, like for instance, it's a wrist fracture. He will call his anesthesia colleague. They will do a block in the cubital level or somewhere closer by. And the patient doesn't have any pain for 48 hours. Similarly with knee replacements. These days we put catheters, we do a femsciatic block, even they inject locally within the joint. The patient's more mobile in the next 24 to 48 hours. So less requirement for hardcore pain medication, like whatever is commonly available. Like otherwise, patients will be taking too much tramadol, too much Tylenol or morphine or something else, and then it leads to more problems. That is the difference.
So acute pain management, according to you, what you try to explain, acute pain is managed by as a teamwork. So then the team, there should be a orthopedician or an oncologist, and the pain management specialist should be adding the ease to the patient. And what about the chronic pain management?
See, chronic pain is commonly when you tell a lay person chronic pain, they are like, what is that? Anywhere where the pain has existed for more than 3 months or 6 months, it is called chronic pain. What comes to immediately to our mind is arthritis. Okay, that's not a pain that goes away. Similarly, other chronic pains are like back pain, headaches. Nowadays, everybody hears of muscle spasm and all over body pain, which we call fibromyalgia. Then there is diabetic neuropathy. Then there are other vascular diseases. People are living longer. The arteries or vessels get clogged. You get peripheral vascular disease, and that also causes pain. Neck pain is so common, especially with so many people working on computers, and even children are always addicted to a small screen. So all that leads to neck pain. We see more and more neck pain. Those will all be chronic pain. And their
So
management will...
chronic pain is managed. Who is going to manage chronic pain? Is it independently by a pain doctor, or it is also a teamwork?
See, usually what happens with chronic pain is generally if the person who sees the patient is a primary care doctor or their family doctor, they usually think, okay, it is back pain. They go to an orthopedic surgeon or they go to a neurosurgeon, or they have knee pain. They send them to an orthopedic surgeon. I think as pain management physicians, we need to educate them more. If with pain, primarily, I feel if they come to a chronic pain management doctor, then we can be the good gatekeepers where simple disc bulges or simple cases of muscle spasm, we can manage them well with therapy, with exercise, with other modalities, and they may not even need an orthopedic or a neurosurgery evaluation. Patients get
So
very
I
frustrated.
was coming to this question.
Yes, go ahead.
I understand. I was coming to this question, but already you have clarified to whom a patient should visit. Should a patient visit to a orthopedician or a neurologist or a pain physician? So you already have clarified that if it is an acute pain, they should visit an orthopedician or respective specialties. But if it is a chronic pain, better to visit a pain management specialist. Am I right?
Correct.
Okay.
Correct.
I'll be coming to the another very important question, because I can tolerate a lot of pain, so I don't need any pain treatment because I can easily tolerate the pain. So my question to you, if somebody is suffering from pain and pain is not treated properly, so what can happen?
Say in cases of children, there are lots of studies and you must have read them too. Like sometimes, they say children, you don't need to treat the post-tonsillectomy pain, or you don't have to treat pain. I think it affects you psychologically over a period of time. And in adults, when you keep on having the pain, especially certain women, they think, oh, they shouldn't complain. They keep on going, they keep on doing. Either you reach a point where your damage is so severe, like arthritis of the knee, like you have left yourself no choice but to have surgery. That is one situation. Secondly, it makes you irritated, it makes you angry. You don't realize when you are in pain how the rest of your family is affected. Your children may be on the edge because they know you are in such severe pain. So there are little things that changes the whole family structure, your day-to-day life. I think even having a conversation with your primary care doctor about your pain is very essential for the total well-being of a person long term.
So psychological issues, social issues are very important. And apart from that there might be rise of the blood pressure, blood sugar, so all this chronic disease will be difficult to treat also if the pain is not treated. So but I'll be coming to the another very important aspect. You already have mentioned about the recent developments in the pain management, ultrasound guided, CM guided interventions, different kinds of blocks in managing pain. But I'll be asking you some other very important questions, coming from India is a place of meditation, yoga, so all those things are there. So I'll be coming to this other part, means your opinion, your role, and particularly your expertise in this field. So I'll be asking you this question: that what are the roles, or is there any role of yoga, exercise, meditations in managing chronic pain? What is your opinion, and what is your, the experience in this regard?
I think the common saying is you use it or you lose it. I think the focus all over the world as we deliver pain care in the form of interventions, whether it's ultrasound, fluoro, CT guided, and paying attention to the socio-economic and what the physically the patient is able to do is very important. Lifestyle modification is extremely important in the management of chronic pain. If you did an injection and the patient went back home, they didn't do any of the physical therapy exercises that you advised, and they simply watch TV all day long, how do you think they are going to get better? So I think we as physicians have a very strong responsibility to make sure that they modify their lifestyle. Simple examples like headache, okay? They may be not sleeping till 2 o'clock, watching or playing video games till 2. And the patient comes to you and they say, headache, you simply write medicine or you do some injections, but you never paid attention to a very vital part of what is their lifestyle. So there are many things that are important, including good sleep, good eating habits, healthy food like fruits and vegetables. And sometimes people eat out of boxes or they eat a lot of food with additives. That may be the reason for headache. I just gave you one example. So I think our country is where yoga originated. And I think if all the pain clinic, or 50% of them, even taught them proper deep breathing exercises, you know very well that when pain gets worse, patients get anxious, they get depressed because of chronic pain. Even if they did pranayama for 5 to 10 minutes, that will help decrease their anxiety and decrease muscle spasm. I think whatever form of physical therapy, not only yoga, whatever they choose is extremely important besides lifestyle modification and healthy eating habits is very, very essential. The sooner we incorporate yoga or other form of therapy as part of chronic pain management and gradually lead them to find a little time for themselves to meditate, to reflect on the day. Our lives, unfortunately, with COVID, it has gotten worse. I think all of us are zoomed out all the time. We are always in front of a screen or we are on the phone. So I think even taking 10 minutes of your time off all the screens, of all technology, and reflecting and relaxing yourself will go a long way in helping many of them.
So thank you very much. That means not just the most modern treatment of different kinds of interventional procedures, but at the same time, we should focus also on the lifestyle modifications, particularly what we have emphasized on the good sleep, good diet, exercises, meditations, pranayams, all these are going to help. And not only that, so it will be maintaining the healthy life and recurrence of the pain will be prevented. So am I right? And as you have suggested, all the pain clinic should incorporate these modalities as a routine part of the management of the chronic pain. So thank you very much. and for joining this. And as we told earlier, that we are trying to cover the different aspects of the pain management, and the main aim is to go to the general people so that they understand that there is something called pain management specialty. I'll be just ending today's session with one very simple question, because many of the people from India also want to know. Sometimes we pain specialists talk that, okay, in India, awareness is very poor among the general population about the specialty. What is the US perspective? How much the general people of the US is aware of or aware of the specialty of the pain management? How much of the general population of the US are they aware of the pain management specialty very nicely? Do they visit a pain specialist when they are suffering from chronic pain directly?
To answer the question in all fairness, I think we pain physicians have a long way to go in educating people about our specialty. In the United States, unfortunately, with whatever has gone on with opioids, generally when you say, oh, you need to see a pain management doctor, the patients here think, okay, I need to go to a doctor who's going to write me a bunch of strong medication, which means opioids. That's what it means here. But we are trying to change that in the last 2 to 5 years with the guidelines for opioid prescription and educating patient more. I will give you a very simple example. I have tried very hard in the last 15 years, like shingles is so common. It happens to anybody, whether you're 40 or 70 or 60. If you have stress, sometimes you can have shingles. So many times I have told my family practice friends that, hey, the lidoderm patch was invented for post-shingles pain. And simple, if you refer the patient within 3 weeks or 4 weeks, you could do so many things to prevent post-herpetic neuralgia, but many of them don't. And patients don't go back and say, they think, oh, I will get the shooting pain, I have to live with it. Sometimes some doctors tell them, oh, there's not much we can do, you just have to live with it. And so I think, there is always education, and you have to also understand in a big city, there are more pain specialists. In a smaller area or in the remote areas, there are less qualified pain specialists. But generally, I think, all of us as a society, we try very hard to educate our colleagues. And hopefully one day, people will understand if they have pain, they need to call a pain management doctor, not anybody else. Let's hope for that day.
Thank you very much. Thank you very much for your valuable inputs, your experiences. So in India, we have to travel even longer than what you are doing there. So thank you very much for joining, and thank you very much for your valuable opinion.
Thank you. Thank you, Gautam, for having me. All the best. Thank you.